Hi Noah, my name is Deirdre. I'm the nurse practitioner student that's going to be working with you today.
Hi.
Before we get started, could you state your age, your gender identity, and your race?
Yeah, I'm a 25-year-old white male.
Okay. Anything else you'd like me to know?
No.
Okay. And could you just tell me why you're here?
Just for a general physical.
Okay. And when was your last physical?
I don't know.
Okay.
It's been a while.
Okay. Do you think it was within the last few years or could be longer?
I don't know.
Okay. And do you remember when you did go, any results that came from that? Like if you had your cholesterol checked, or if you had any updated immunizations, that kind of a thing?
I did have updated immunizations at a different visit, but not during a physical.
Okay. Do you know if you've had your cholesterol checked?
No.
Okay. And I noticed you're wearing glasses. Do you see an eye doctor regularly?
Yes.
Okay. When was that last visit?
In the last 3 months.
Okay. And what were the results of that?
No changes.
Okay, great. And how about a dentist? Do you see a dentist regularly?
No.
Okay. I can provide you with some recommendations for dentists. I definitely recommend routine dental care for cleanings to help prevent cavities and keep an eye out for that. All right. And then can you just tell me a little bit about how you perceive your health to be?
Really good. Yeah.
Okay.
Nothing, no issues.
Okay. And what do you do to keep your health up in terms of, physical activity, that kind of a thing?
Yeah, definitely try to exercise regularly, 3 or 4 times a week, and eat healthy foods, lots of fruits and vegetables, fish, poultry, very little red meat.
Okay. And what kind of activities do you do for exercise?
Biking, running, hiking, some at-home workouts here and there.
Okay, great. And how's your sleep?
Good.
Okay. How many hours of sleep do you usually get per night?
Between 8 and 9.
Okay. And do you feel rested in the morning?
Yes.
Okay, great. All right. And I just wanted to ask a little bit about any stressors that you have going on currently. Could you just tell me a little bit about that?
Yeah, so my work is definitely a stressor, but I would say in general that's kind of the only thing that really stresses me out.
Okay. What do you do for work?
I'm a flight instructor.
Oh, great. And what kinds of things do you use to help cope with the stress that you feel from work?
Exercising, going for walks, and just trying to relax when I get home.
Okay. And do those strategies feel manageable in terms of mitigating the stress?
Yeah.
Okay, great.
Yeah.
And then I just want to hear a little bit about your past medical history. So first, I'd just like to know if you have any allergies, either to the environment, food, medications.
No.
Okay. Are you taking any medications currently?
No.
Okay. What about over-the-counter supplements?
No.
No. Okay. And did you have any major illnesses as a child, like chicken pox, anything like that?
I had chicken pox and whooping cough.
Okay. Any complications from that?
No.
Okay. And have you ever been hospitalized?
No.
Okay. Have you ever had a surgery?
No.
Okay. And any major accidents or injuries?
Well, I did have an oral surgery when I was really, really young.
Okay.
But that was it.
Okay. Do you know what that entailed or what that was for?
No.
Okay. But no complications or?
No.
Okay. And have you had any accidents
No.
or major injuries?
No.
Okay. And I know you mentioned that you had some immunizations recently. Do you know if you've had the full childhood immunizations?
I believe so, because I wasn't immunized as a child, and the point was to kind of get all of those done. So
Okay.
I don't know exactly.
Do you know if you had the measles, mumps, and rubella vaccine?
Yes.
Okay.
I did.
and a tetanus vaccine?
Yes.
Okay. Do you know if you've had the HPV vaccine?
No.
Okay. So we could look, you know that you haven't had it, or you're not sure?
I'm not totally sure.
Okay, so we could look into that more and provide that. All right. So then I just wanted to just hear a little bit about your family health history. Any major family medical history that you can think of right off the bat?
The only thing is some heart issues on my dad's side. My dad had a valve repaired. It's a congenital thing, my grandpa, his dad had a heart attack and got a quadruple bypass.
Okay. And do you know if you've ever been told that you have any issue with your heart?
No.
Okay. You're not sure, you haven't had that?
I haven't been told.
Okay.
Yeah.
All right. And any history of high blood pressure?
No.
Okay. And either of those or anyone else in your family I'm speaking to now?
Yeah, I'm not sure about anybody else.
Okay.
Specifically.
Okay. Do you know if there's any family history of high cholesterol?
Not that I know of.
Okay. Stroke?
No.
Okay. Diabetes?
No.
Kidney disease?
No.
Liver disease?
No.
Okay. Epilepsy or seizures?
No.
Thyroid disease?
No.
Okay. Tuberculosis?
No.
Asthma or any other respiratory disease?
No.
Okay. Any family history of depression or anxiety?
No.
Schizophrenia?
No.
Okay. Any family history of cancer?
My mom's mom has had cancer, breast cancer, a couple times.
Okay. All right. And then just to hear a little bit about your family more generally, can you just tell me a little bit more about your family?
Yeah. They live nearby, and my parents were divorced when I was 10, and then I spent equal amounts of time with them from then until I moved out after high school, and yeah.
Okay. Do you have a close relationship with them?
Yeah, fairly close.
Okay.
See them regularly.
Okay. Who do you live with now?
My fiance.
Okay. Do you feel safe at home? Any
Yes.
concerns about verbal or physical abuse?
No.
Okay. Are you sexually active?
Yes.
Okay. And what kinds of forms of contraception, of protection do you use?
Yeah, use condoms, and my fiance has an IUD.
Okay. And just some other safety questions. Do you wear, do you use seatbelt? Do you use a seatbelt in the car?
Yes.
Okay. Do you wear a helmet when you ride a bike?
Yes.
Okay. Are there smoke alarms and carbon monoxide detectors
Yes.
at your house? Okay. And do you use sunscreen?
No.
Okay. So it's definitely something I recommend to help prevent any long-term skin damage from the sun, as well as preventing any types of skin cancer. So that's definitely something I would consider starting to use. And any history or current tobacco use, so smoking, vaping, chewing tobacco?
I did smoke a little bit in high school, just a cigarette here and there, socially.
Okay, would you say once a week, once a month?
Once a week,
Okay.
probably.
And for about how long?
A few months.
Okay. Any current tobacco use?
No.
Okay. Well, that's great that you're no longer using tobacco. We know a lot about the long-term damage of tobacco use, so I encourage you to continue to avoid using that. Any other type of drug use?
No.
Okay. And do you use alcohol?
Yeah. Probably I'll have a beer or a glass of wine every other night.
Okay.
On average.
Okay. All right. Then I just want to next just ask you about any symptoms that you might be having or have had just from head to toe going through the body systems. Does that sound okay?
Yeah.
Okay. So first, any generalized weakness in your body? Any fever or chills?
No.
Any weight loss or weight gain?
No.
Okay. And then just thinking about your skin, any rashes or bruises?
No.
Any dry or itchy skin?
No.
Any changing moles? Any lumps or bumps?
No.
Okay. Any changes to the texture of your hair?
No.
Any hair loss?
No.
Okay. Any dry or itchy scalp?
No.
Okay. And then thinking about your nails, any change, any thickening or thinning of the nails?
No.
Okay. Any, bluish discoloration of the nails that you've noticed?
No.
Okay. All right. And then I just want to think about and talk about your head. Any headaches?
No.
Head injuries?
No.
Okay. Any dizziness or lightheadedness?
No.
Okay. And I know that you're wearing glasses, and you said you had a recent eye exam. Any blurry vision or changes to your vision?
No.
Okay. Any lights or flashes in your vision?
No.
Okay. Any itchy or watery eyes?
Nope.
Any drainage from the eyes?
No.
Any redness
No.
that you've noticed?
No.
Okay. And any earaches?
I did have a little bit of ear pain a couple weeks ago that kind of transferred down into my throat, lasted for a day and a half or so, then it went away.
The right ear?
Yeah.
Okay. And it just resolved on its own?
Yeah.
And no recurrence?
No recurrence.
Okay. Any reduced hearing
No.
out of either ear?
No.
Okay. Any drainage from the ears?
No.
Okay. And any stuffy or runny nose?
No.
Any nosebleeds?
No.
Any frequent colds?
No.
Okay. And any difficulty swallowing?
No.
Any toothaches?
No.
Any bleeding gums?
No.
Any lesions inside your mouth that you've noticed, like sores?
No.
Okay. All right. And any stiffness or pain in your neck at all?
Nope.
Any swollen glands in your neck that you've noticed?
Nope.
Okay. Okay. And any changes to the breast tissue at all? Any enlarged breast tissue that you've noticed?
No.
Any lumps or bumps in the breast?
Nope.
Any nipple discharge?
No.
Any pain?
No.
Okay. And then thinking about the lungs, any cough?
Nope.
Wheeze?
No.
Okay. Any difficulty breathing?
No.
Pain with breathing?
No.
Okay. Thinking about your heart, any chest pain?
No chest pain.
Any history of having high blood pressure?
Nope.
Okay. And are you noticing at all that you have to prop yourself up at night to breathe better?
No.
Okay. Any swelling in your legs?
No.
Okay. Any feelings of palpitations or an irregular heartbeat?
No.
Okay. All right. And any acid reflux, regurgitation, indigestion?
I'll have a little reflux here and there if I eat something that's kind of acidic.
Okay.
Or not even acidic, just random stuff sometimes.
Okay. And if you avoid certain foods, do you find that helps reduce?
Yeah, but it's random sometimes. So
Okay.
It's hard to tell.
And could you describe it a little bit more?
The reflux or?
Yeah, kind of what you notice when it happens.
Yeah, just like a burning kind of in my throat.
Okay.
And yeah, usually Tums takes care of it.
Okay. Any nausea or vomiting?
No.
Difficulty swallowing?
No.
Abdominal pain?
No.
Okay. Any black or bloody stools?
No.
Okay. Any pain with having bowel movements?
No.
Okay. And has anyone ever mentioned that your skin or your eyes look yellow?
No.
Okay. And any issues with varicose veins?
No. Varicose.
Varicose veins, they're just tend to be larger appearing veins that sometimes can be painful, sometimes in the legs.
No.
Have you noticed that at
No,
all?
no.
Okay. Any history of having blood clots?
No.
Okay. Any pain in the legs with walking?
No.
Okay. And you said already no swelling, correct?
No.
Okay.
No swelling.
Okay. And any difficulty with urinating? Any hesitancy of your stream or dribbling or incontinence of urine?
No.
Any pain with urination, going urgently or often?
No.
Okay. Any blood in the urine?
Nope.
Okay. And any history of sexually transmitted infections?
No.
Okay. Any discharge at all from the penis? Okay. Any lesions on the penis? Okay. Any scrotal masses, lumps, swelling?
No.
Okay. All right. And just thinking about the whole body in general, any joint pain or stiffness?
No.
Okay. Any body aches?
No.
Okay. And you said earlier no major accidents or injuries?
No.
Okay. Any joint swelling?
No joint swelling.
Okay.
No.
All right. And any changes to your mood at all?
Nope.
Okay. Any anxiety?
No.
Okay. Any thoughts of harming yourself or anyone else?
No.
Okay. Do you ever notice you see or hear things that other people don't?
No.
Okay. Any changes to your memory at all?
No.
Any changes to your vision or your speech?
No.
Any changes to knowing who you are, where you are, who you're with, that kind of a thing?
No.
Any numbness, tingling, or weakness of your extremities?
No.
Have you ever had seizures?
No.
Okay. And any have you ever noticed any easy bruising or bleeding?
No.
Okay. And any have you ever noticed any enlarged lymph nodes?
No.
Okay. And any heat or cold intolerances?
No.
Any excessive sweating or
No.
thirst?
No.
Okay. Any increase in urination?
No.
Okay. Anything that that didn't come up through that you'd like to tell me of things that you've felt or symptoms that you've had?
I don't think so.
Okay. I also did want to ask you. It sounds like overall you're very healthy and don't have any major health concerns. Have you ever been diagnosed with any health conditions like diabetes, asthma, thyroid disease, anything like that?
No.
Okay. So next we're just going to check your blood pressure, and I'm just going to state that your height today was 67 inches, your weight was 145 pounds, your temperature was 98.6, your heart rate was 60, your respirations were 16, your O2 sat was 99% on room air. And I'm just going to go ahead and check your blood pressure now. Bring your arm like that, right? And I'm actually going to just support your arm, so just let it relax here. And I'll have you uncross your ankles for me too, so your feet are nice and planted. Good. Great. Your blood pressure is 100/60. All right. So the next part of our visit today is just going to be the physical exam. So I'm just going to have you get changed into a gown, and
Okay.
then we'll go from there.
Sounds good.
Okay.